Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. And this Wednesday, I'm going to continue our discussion on weight loss. So last week, we discussed how weight affects health and lifestyle behaviors that facilitate natural, lasting weight loss. So today, I'm going to talk about weight loss medications because many people are interested in losing weight, and many try hard to lose weight. And sometimes they're successful, either with lifestyle changes or with medicines or with both, but many regain the weight. And this back and forth can be so frustrating. So today I'm going to share 3 tips on how to use medications to facilitate lasting weight loss. But before we get into it, as you know, hit that subscribe button. That's how people we get this information to more people. So go ahead and hit the subscribe button. You're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm double board certified in family medicine and lifestyle medicine, and I'm the owner of In Touch Primary Care in Sugar Land, Texas, a Houston suburb. You can check us out at www.intouchprimarycare.com. So, what are common weight loss medications and how do they work? So, there are 5 common ones that FDA approved in the US: Orlistat, phentermine, topiramate, Contrave, liraglutide, and semaglutide. And pretty much most of them work by just decreasing your appetite, so making you feel less hungry, except for Orlistat, which actually works by changing how you absorb fat. So for the most part, though, it's about making you less hungry. So studies done at 52 weeks for phentermine, topiramate, Contrave, and Orlistat, and at 68 weeks for semaglutide and liraglutide show a 6 to 15% body weight loss compared to a 1 to 2% weight loss in people not taking medications. So weight loss medications work. At least they work while you're taking them. So how do you decide which one works for you? It depends. It depends on several factors, right? For example, a person that has prediabetes or diabetes or insulin resistance or even PCOS may benefit from semaglutide, for example, while somebody that may be trying to quit smoking as well as lose weight may benefit more from Contrave. Another person with heart disease, and maybe they don't tolerate the semaglutide, may do well with without heart disease if they don't have heart disease and they don't tolerate semaglutide. Maybe the phentermine might be a better option for them. So the bottom line is it's not one size fits all. It really depends on your health history, your health goals, how you tolerate the medication. And really, it should be a decision that you make with your doctor. Because while it might be, tempting to just start taking what everybody else is taking right now from any source, it's important to be aware that many of these medications do have side effects, and the side effects can be mild, like abdominal symptoms that once you stop go away, or it can be more serious, like increasing your risk of heart disease or even cancer, depending on the medicine. So that's why weight loss medications shouldn't be taken without a plan for close monitoring by your doctor. So it's important that you're working with someone that knows, that can help you with it. Okay, so how do you facilitate lasting weight loss while taking medicine? So I'm going to share just 3 tips. So number 1, many medications can be used long-term. And sometimes people are so eager to get off medications that they stop too early. And that prevents them from maximizing the weight loss that they can get on the medicine. So when you start medication, it's helpful to have a goal, but it's also helpful to understand that it is possible to regain the weight. So having a solid plan after you are done with the medicine is so important, so that you are not just staying on medications and stopping your medicines, regaining the weight, going back on medications. That's not, very fun for anybody to do. So you want to make sure that you have a plan for it. The other thing that is so important is number 2, don't rely on medication alone. So if you're trying to lose weight and you're working on, and you're using medications, and you don't have time to do the lifestyle changes that are required, then it's probably not a good time, because while you're on medicines, that's the best time. The medicines are helping you suppress your appetite or helping you process your fat differently. That's a great time to start working on lifestyle changes, like incorporating more vegetables, or being consistent with your physical activity, or eating more fiber, or just learning the things that will help you, doing low impact exercise, walking, swimming, yoga, things like that. You want to start to work on those habits while you're taking the medicine, because when you stop taking the medicine, you want to have those habits already so that you can continue to lose weight or maintain the weight loss. So that's something that I want to really stress. Even people that do surgery for weight loss can gain the weight back. And that's because if the habits don't change, the weight is going to come back. So it's so important that we're not relying entirely on just medications to produce change. The medications help, but they help. It's so important to work on lifestyle behaviors to facilitate and maintain weight loss. And then the last thing for lasting weight loss is follow up closely with the health professional. So I touched on this earlier. There is so much misinformation online with all kinds of people, some medical, some little medical knowledge, some no healthcare background, and they're giving a lot of information about weight loss. And yes, a lot of things could work temporarily, but when there isn't a solid understanding of how the body works in general, you could be fixing something and causing something else. So there are unhealthy ways to lose weight, and you will lose weight, but then you may be causing many other conditions while you're losing weight. So you want to work with someone that is going to help you lose weight in a healthy way, and not with someone that's just going to help you lose weight temporarily. So making sure you're working with a health professional, a doctor, a certified health coach, a dietitian, nutritionist, while you're taking medication, because they'll make all the difference. You end up saving a lot of time, a lot of headaches, a lot of frustration, and weight loss will be lasted. So imagine that you feel better, your mood is better, you have more energy, you have mental clarity, and the weight stays off. So there's so many benefits of losing weight, especially if you're incorporating lifestyle changes with it, because even if you don't lose as much weight as you want to, just by incorporating lifestyle changes, you're becoming healthier. And so that is so key, because there are a lot of skinny people that are not healthy. So it's not all about weight. So it is important that while you're working on weight loss, which may be your goal, actually the more important goal is being more healthy. So if you're focusing on that, the way you lose weight changes. That's all I have for today. If you are in the Houston area and you're looking for a doctor that is proactive about your health, check us out at In Touch Primary Care. We do things very differently at In Touch. Our practice is set up so your visits are not rushed. You can reach us easily, so you don't have to delay your care. And we can see you even if you don't have health insurance. You can find out more. And if you do have health insurance, we can see you too. Everything is membership though, so we're out of network for all health insurance. You can find out more on our website, www.intouchprimarycare.com. So until next week, I'll see you again at 2:15 p.m. on Wednesday next week. Thank you for listening. Have a great day.